Thanks for joining me, and we're going to start with that. Our hospital is overflowing here in South Mississippi fighting the virus. Thousands of new COVID cases, the most we've seen since the pandemic began. A crisis situation for those on the front lines of this medical battle. And joining us with his views on this and to get us up to date on the situation, Singing River Health System CEO Lee Bond. Lee, thanks for being with us. There's no doubt about it, this surge is very real, and I hope everybody realizes that. Positive cases, I think on Thursday, more than 3,100. On Friday, over 2,000 hospitalizations, 1,154. You are calling this a new disturbing peak. What's the situation at Singing River?
It's tough, Dave. It's really tough. We are seeing record levels at every facet of our business, and we had 118 inpatients between our three hospitals yesterday. And it's down a tiny bit today. I'm praying that the slope of the curve down will be as fast as it was up, but I don't know that that's going to be the case. I'm a little concerned that this weekend it could escalate some more. So it's bad. It's tough. Our people are working their butts off to do everything they can to keep people safe and do what we do. But it's a new pinnacle of challenge for sure.
And it's the residual, kind of the domino effect, Lee. Not only does it impact the people who are in the critical care, but it's into the emergency rooms. It's getting into other resources at the hospitals that are having to be used. So how stretched are you?
We are stretched. We implemented, I'm very proud of our team. We did a volunteer thing. We've asked just about everybody who can, clinical or non-clinical, to help work after hours, and we put together quite a team of volunteers to help with flow and the non-clinical parts too. But people are stretched to the limit, and not just our nurses are so tough. I'm so proud of them, the grit and the just the way they are hanging in there and doing what they got to do to save lives. But it's stretching families, Dave. When you see people in here suffering, not able to breathe with COVID, younger people too, by the way, people in their 30s and 40s and 50s, it is stretching their families. I have seen more tears of families and suffering and regret and just the whole spectrum of emotions have never been so high. It is absolutely terrible what's happening in this region right now.
Now, you put out a statement. I read it. It was so thorough. There was so much information on it. And you made sure to say that you don't want to shame anyone when it comes to getting vaccinated, because there's a real, as you and I both know, kind of political, cultural debate going on. But from where you sit, what is the difference in people's lives between being vaccinated and unvaccinated?
Well, here's a fact, and this is just math, Dave. It's just math. If you are vaccinated, you are not going to end up, you're not going to die, and you're probably not going to end up hospitalized. Right now, we had 2 patients out of those 118 that were vaccinated, and both of them had a comorbidity. So if you're a reasonably healthy person, maybe with one comorbidity, and you're vaccinated, you are not going to end up in the hospital. I mean, look at the national numbers, 162 million people vaccinated, and like 0.4% hospitalized or actually die that don't have a comorbidity or over 65. So I think that the difference is not only will it save your life, it will reduce the strain on your family and caregivers. I had a person that I know personally, the last words he said, 50 plus years old, but the last words he said to the nurse was, please, please get my wife to get vaccinated and tell her don't listen to anybody except the doctor. Talk to your doctor. Don't listen to some Russian mRNA inventor on YouTube or somebody like that. Talk to your doctor. They're the one that will tell you whether vaccination is appropriate for you. But more to your point, we're not going to, look, I understand why people have been scared, and we don't want to politicize this. Our, kind of like the horror, love all, serve all. We're going to take care of everybody, whether you're vaccinated or not. We're going to do everything we can for you. But now is the time, as the good book of Ecclesiastes says, there's a time for everything. Now is the time. If you've been on the fence, do it. We highly recommend it.
And Lee, you guys are also getting very aggressive on that front. I know you've opened up walk-in clinics for vaccinations in Pascagoula and Gulfport. A third is on the way. Are you seeing a very real uptick? I mean, do people seem to be getting the message?
We are. I think, unfortunately, unless somebody knows a loved one that's died or been hospitalized from it, they're a little less likely to do it. But yes, we're seeing a big climb. We opened up a pop-up site inside the HealthPlex in Pascagoula at Singing River Gulfport on the grounds at the hospital, and probably gonna do something at the Cedar Lake Clinic to try to, vaccinate as many people as we can. We're at the point where that might be the only quicker way out of this, or avoiding another possible surge for us is a few more people to be, a lot more people probably to be vaccinated.
I want to go back to that message you sent out, because I found this something that we really need to be having a talk about on the statewide level, from the governor, the lieutenant governor, the legislature. You pointed out we're getting $1.8 billion on this latest federal COVID relief package. You would like to see a portion of that money go towards retaining nurses, making sure hospitals are fully staffed.
Absolutely. That's a lot of money. The difference between $1 million and $1 billion is phenomenal. And to get $1.8 billion, and we have so many not-for-profit hospitals like us in the state. A not-for-profit, we see indigent patients who don't pay, and we operate on a zero margin basis. So we don't have funds. We don't have money. If we could find somewhere to get it, we would do it. We don't have the money to pay these retention bonuses that the big for-profits in Texas and Florida and other places can pay. But we think that if they just took 25% of those funds and allocated it to bedside nurses to retain them in the state where it's hardest to be a nurse because we're the most unhealthy state, and paid every nurse $20,000 to stay for 2 years, that would be the highest and best use of that money. They would spend it in Mississippi. Hospitals like us don't have it. There's hospitals right now, we're about 6% contract labor. We're probably about 6.5% by the end of the week. But hospitals that are pushing 10% contract labor, if they're a not-for-profit in Mississippi, they can't sustain that. They will go bankrupt.
Well, if members of the coastal legislative delegation are watching us this morning, I hope they get that message. Lee, I want to hit a few things before we run out of time. You don't want to mandate that employees throughout the Singing River Health System get vaccinated, but you're encouraging it, and I understand you might be getting close to 70% as you've taken steps and measures to get more and more of your staff vaccinated, your workforce. Tell us about that.
Yeah, so we're not going to mandate it. There's some reasons we would certainly like to, but right now our highest calling, our highest mission is to save lives. And if we put a mandate in and Mobile, Alabama doesn't, and we lose a dozen nurses that have some personal reason they don't want to get it and they leave, that puts us in a position where we might not be able to take care of somebody with a different non-COVID situation. So our most important factor in the decision is how can we save the most lives and improve health for the most people? And a mandate would not facilitate that. And it's very political. We try to stay away from the political side of it. Our little mantra has been, put a little love in your heart, be kind to each other, and be a little understanding of the differences and opinions that people have. And that's something the world needs a lot more of right now.
Lee Bond, CEO, Singing River Health System. I know you've been busy. People obviously heard the passion in your voice. God bless you and everybody on the front lines of this medical battle, and thanks for being with us, Lee.
Thank you.
COVID is real, and as a community, we must reduce its impact. We need you. We need your commitment in the face of this storm to do what it takes to stop it in its tracks.